Breastfeeding in the childcare setting. Breastfeeding Basics. This presentation was compiled in collaboration with the Maine Roads to Quality program and the State of Maine Breastfeeding Stakeholders Committee. Breastfeeding is important because it's the best nutrition source we have readily available worldwide for our babies. As you begin this training, it's a good time to reflect on your own feelings and beliefs surrounding breastfeeding. Were you yourself breastfed? If you have children, did you breastfeed your children? What do you already know about breastfeeding? What has been your experience with breastfeeding at your childcare settings? Answering these questions allows us to identify with our own relationship with breastfeeding and perhaps identify any stigmas that may exist on the topic. So what does childcare have to do with it? The it that we talk about here is breastfeeding, and childcare actually has a very vital role to play in its success. As childcare providers, you can be a huge support to mothers who are breastfeeding, whether it be mothers you employ at your sites or mothers whose children are in your care. At the end of this training, you are not expected to know everything there is to know about breastfeeding, nor are you expected nor encouraged to give out medical advice unless your credentials allow for such. It's evident some mothers find breastfeeding easier to manage than others may. We need to remember every baby is different, so moms may find it difficult to breastfeed one child when it may have been easier to breastfeed another of their children. Moms who are breastfeeding need support from many different directions to be able to meet their breastfeeding goals. Support can come in many forms, and it can mean understanding the basics of breastfeeding so that you as the provider can listen to their concerns they are having, knowing your local resources so that you may connect them with the medical community that can continue to assist them in their breastfeeding efforts, understanding how to properly handle and store breast milk at your sites, and then creating an environment that sees breastfeeding as welcoming and important for the child, not something that is seen as indecent, which many times our society does. You have an important role to play as the child care provider in encouraging these efforts and connecting families to appropriate resources within your communities. Healthy Kids, Healthy Futures reports that there are approximately 12 million children and babies that are in child care nationwide. According to the Centers for Disease Control, nearly 2/3 of infants are regularly cared for by someone other than a parent. Approximately 50% of these infants attend child care centers, while the remaining are in home-based settings to include licensed family-based child care homes or the homes of family and friends. With such a large portion of our youth being cared for by additional caregivers, we can see where the child care provider can play a vital role in promoting breastfeeding among mothers whose children are cared for in these facilities. The good stuff found in breast milk cannot be duplicated by any other milk source. This image comes from the California Department of Health and Human Services WIC office, and as you can see, breast milk has far more good things that a baby needs. These things include antibodies, hormones, growth factors, vitamins, minerals, and enzymes. The benefits of breast milk to a child are great. There is a decreased risk of childhood and adolescent obesity and an increased protection against asthma and eczema when breastfed exclusively for at least 4 months. Exclusive breastfeeding of a child with a family history of diabetes for at least 4 months reduces their risk of insulin-dependent, also called juvenile onset diabetes. According to the United States Breastfeeding Committee, children who are breastfed score higher on cognitive and IQ tests and have a decrease in infant mortality rates by 21%. The incidence of infectious disease is also greatly decreased in children who are breastfed. These diseases include diarrhea, respiratory tract infections, ear infections, meningitis, necrotizing enterocolitis, urinary tract infections, and late-onset sepsis in preterm infants. We can't have a presentation about breastfeeding without also talking about the preventive benefits related to SIDS rates, or sudden infant death syndrome. The American Academy of Pediatrics in October of 2011 released a policy statement on SIDS to include an expansion on recommendations for safe infant sleeping in general. The recommendations in the policy statement include the following: supine positioning of baby, firm sleeping surface, room sharing with baby without bed sharing, routine immunizations, pacifier use considerations, avoidance of the following: soft bedding, overheating, exposure to tobacco smoke, alcohol, and other illicit drugs, and lastly, promotion of breastfeeding. The AAP policy statement goes on to further state that the protective effects of breastfeeding increases with exclusivity of breastfeeding. However, any breastfeeding has been shown to be more protective against SIDS than no breastfeeding. Beyond the benefits of breastfeeding for the child, which we just discussed, there are also benefits to be had of the breastfeeding mother. The benefits for the mom include cost when you compare breastfeeding to other feeding options, decreased postpartum bleeding, early return to pre-pregnancy weight, decreased risk of cancer, which includes breast and ovarian cancers, and there is also a possible decreased risk of osteoporosis when a woman who is breastfed enters the postmenopausal period of life. There's a bumper sticker I have hanging above my computer at work, and I've grown very fond of it over the years. It states affordable health care begins with breastfeeding. Take a minute to think about that phrase. Children that are breastfed are on average healthier children than children who are not breastfed. The decrease in medical costs means an increase in monies back into families' pockets. Parents whose children aren't sick have less time they must take off from work, a benefit for you as a child care provider as well. As a whole, families who are healthier have more time to bond with one another, with less focus and stress placed on illness. Recent research shows that if 90% of families breastfed exclusively for 6 months, nearly 1,000 deaths among infants would be prevented. The U.S. would also save $13 billion per year on medical costs. Medical care costs are lower for fully breastfed versus never breastfed infants. There are also environmental benefits to be had with breastfeeding. Breast milk is one of the few foods produced and delivered to the consumer, i.e. the child, without any unnecessary packaging, pollution, or waste. And for that fact, I really appreciate this quote from Dia L. Michaels that says, breast milk may look white, but actually it's as green as can be. And you can actually download the full version of this story at breastfeeding.com. Our nation's current breastfeeding recommendations are the following: to exclusively breastfeed babies for the first 6 months of life, and to continue breastfeeding babies up to 1 year and beyond after the introduction of solid foods around 6 months. The American Academy of Pediatrics, the United States Breastfeeding Committee, the Academy of Breastfeeding Medicine, the American Academy of Family Physicians, the World Health Organization, and the United Nations Children's Fund all agree with these current recommendations. According to the AAP 2005 policy statement on breastfeeding, exclusive breastfeeding is sufficient to support optimal growth and development for approximately the first 6 months of life, and it provides protection against diarrhea and respiratory tract infections. Breastfeeding should be continued at least for the first year of life and beyond, as long as mutually desired by the mother and the child. There really is no cutoff point where breastfeeding is recommended to cease. The most crucial time frame for a baby to receive breast milk is in that first 6 months of life, where there is rapid growth and development occurring. At 6 months, we know we shift towards solid introduction, and baby starts to rely more on solid foods. However, milk still plays a vital role in development. A mother and child should be encouraged and supported to continue to breastfeed as long as she so wishes, and focus on a baby-led weaning methodology. Our nation's health goals, also known as Healthy People 2020, have a section specifically related to breastfeeding. The target areas for these goals look at those children ever breastfed, those children breastfed for 6 months in duration, those breastfed for 12 months in duration, those breastfed for 3 months exclusively, and those breastfed for 6 months exclusively. This table depicts where we currently stand as a nation in regards to breastfeeding rates and where we hope to be by 2020 to reach the Healthy People goals. You can see, based on the target areas, what our current rates are in regards to breastfeeding compared to our 10-year national goal. And as you can see, we are yet to exceed any of those in the column to the far right. So there is still work to be done. As child care providers, you do have a role and can be an active support system for our breastfeeding mothers and helping achieve these goals by 2020. There are a number of different initiatives going on nationwide to also assist in reaching the Healthy People 2020 goals in regards to breastfeeding. One such initiative is the baby-friendly hospitals. According to the Baby-Friendly Hospital website, the Baby-Friendly Hospital Initiative is a global program sponsored by the World Health Organization and the United Nations Children's Fund to encourage and recognize hospitals and birthing centers that offer an optimal level of care for infant feeding. The BFHI assists hospitals in giving mothers the information, confidence, and skills needed to successfully initiate and continue breastfeeding their babies or feeding formula safely, and give special recognition to hospitals that have done so. The intent is that with more baby-friendly hospitals nationwide, a positive effect on breastfeeding initiation and duration could be the end result. Maine currently has 5 baby-friendly hospitals, and they are York Hospital, Miles Memorial, Central Maine Medical Center, Maine General Medical Center, and Bridgeton Hospital. With Maine having 5 baby-friendly hospitals, we can see here on this slide, they actually exceed the national average for the percent of live births occurring at baby-friendly facilities, which is a really wonderful thing. The U.S. national average is 4.53% of births occur at baby-friendly hospital facilities, compared to Maine's 19.41% of live births. According to the Centers for Disease Control, improving the health of mothers and their children is a primary goal of the Centers for Disease Control and Prevention. Protecting, promoting, and supporting breastfeeding with its many known benefits for infants, children, and mothers is a key strategy toward this goal. There are many ways that communities support mothers and babies to breastfeed, and everyone plays a role. The CDC Breastfeeding Report Card brings together state-by-state information to help tell the story of breastfeeding practices in states. It compiles many types of data so states can monitor progress, celebrate state success, and identify opportunities to work with health professionals, legislators, employers, business owners, community advocates, and family members to protect, promote, and support breastfeeding. Mothers need support from the people and organizations they interact with to meet their breastfeeding goals. And those people and organizations include their child care providers. Beyond birth facility support mentioned in the last slide, there are 6 additional indicators that are used to measure breastfeeding-friendly communities. One of these indicators is support in child care settings. Listed here on this slide are 5 of the 7 indicators. To see a complete listing of the CDC breastfeeding report card, please see the reference list on the end of this presentation. You can also go to cdc.gov/breastfeeding/data/report card to get a complete view. To talk about the basics of breastfeeding, we must also talk about the importance of attachment and bonding. As stated directly from the Caring for Our Children National Health and Safety Performance Standards, 3rd edition, breastfeeding sets the stage for an infant to establish healthy attachment. Rooming in with a baby versus co-sleeping with a baby sets the stage for parental bonding with their newborn. The action of a baby suckling actually changes how a mother's brain behaves, promoting oxytocin release, or the love hormone, resulting in enhanced feelings of trust, love, and affection. Oxytocin is produced in the hypothalamus of the brain. According to the Journal of Public Library of Science Computational Biology, normal brain cells or neurons release chemicals such as oxytocin in relatively small amounts from their nerve endings. The research team, led by Warwick University scientists, has shown using computer models that when a baby suckles, the mother's neurons respond by churning out the hormone from their dendrites, the part of the cell that usually receives rather than transmits information. This extra release of oxytocin creates much stronger links between nerve cells, creating a positive feedback loop, where the greater the concentration of the chemical, the faster it is produced. When you have the opportunity, take a minute to review the 3rd edition of Caring for Our Children and take a close look at Chapter 4 on nutrition. To quote a part of this chapter, "Human milk, containing all the nutrients to promote optimal growth, is the most developmentally appropriate food for infants. It changes during the course of each feeding and over time to meet the growing child's changing nutritional needs. All caregivers and teachers should be trained to encourage, support, and advocate for breastfeeding. As caregivers and teachers, you have an opportunity to positively affect breastfeeding duration and possibly initiation by providing support to breastfeeding mothers, whether they be your staff or parents of children within your care." To find out where your facility currently stands in regards to infant feeding, I encourage you to take a look at the Let's Move Child Care Infant Feeding Checklist quiz. This is an initiative of First Lady Michelle Obama. The Let's Move Child Care initiative has 5 main goals. 1 is to get kids moving. 2, reduce screen time. 3, make nutrition fun. 4, offer healthier beverages. And 5, support infant feeding. The Let's Move Childcare Infant Feeding Checklist is available online at healthykidshealthyfuture.org. The Let's Move Childcare Infant Feeding Checklist is a self-assessment that covers the following main subject areas: breastfeeding education, breastfeeding environment, and breastfeeding policy. Utilizing this checklist is a good starting point for assessing your individual sites on current practices around breastfeeding and can help identify areas of needed improvement.